Hi, my name is Ali Balico, and we'll be discussing kidney cancer and the effects of exercise on it. For epidemiology, kidney cancer is a very uncommon form of cancer, accounting for about 2 to 3% of all adult cancers. Renal cell carcinoma accounts for about 90% of those cases, which is a very, very small amount. Kidney cancer usually affects the older population, ages from about 50 to 70 years old, so not us younger people, unless you're predisposed, but North Americans and Europeans are the primary geographic pattern having the highest percentages of cases. Risk factors include smoking, obesity, chronic kidney disease, long-term dialysis, and genetic predisposition. There's been an increasing trend in finding kidney cancer due to better imaging and technology, which has led to a decline in mortality rates. And this is just a graph showing an upward trend and a sharp increase in cases of kidney cancer being found in men and women, which is a good thing because of all of our increasing technology that we're finding this and getting it treated quicker and better. For our pathophysiology, kidney cancer originates from the renal tubular epithelial cells, or the tissues that line the tubes of your kidneys. Renal cell carcinoma is also the most common type of kidney cancer, and it develops in the lining of the nephrons of the kidney. In renal cell carcinoma, that is a mouthful, the VHL gene, which is a tumor-suppressing gene that we all have, mutates or is inactivated. Normally, this gene aids the cells in disposing of a protein called HIF, or hypoxia-inducible factor, when oxygen levels are normal within the cells or in the body. However, when the VHL gene is mutated or shut off, it can't dispose of HIF, and as a result, it builds up within your cells. The buildup tells your cells to act as if they are in a hypoxic state, low oxygen state, even if there is oxygen readily available. In response to this, the cells start to overproduce growth factors VEGF and PDGF, or vascular endothelial growth factor and platelet-derived growth factor. Both of these are responsible for growing new blood vessels throughout your body through a process called angiogenesis. Because they're stimulating new blood vessel formation, unfortunately, the tumor is being supplied with extra oxygen and nutrients, allowing it to grow and spread faster. And here's just a little chart of renal cell carcinoma risk factors that you can read through at any time. Symptoms of kidney cancer in early stages are just pretty much blood in the urine, but during early stages, it's hard to catch. In the later stages, you will, well, not you, but you could have pain in your lower back or side, lumps in your abdomen, swelling in the legs, ankles, or feet, high blood pressure, fatigue, anemia, fever, loss of appetite, weight loss, and shortness of breath. For diagnosis, kidney cancer is usually diagnosed through a series of tests like physicals to check for lumps and bumps, imaging to see what's going on your insides, and finally biopsies to determine malignancy and or type of cancer. From there, you get answers and move on to treatment. The effects of kidney cancer on the exercise response. People who engage in regular physical activity have a 50% lower risk of death from kidney cancer compared to inactive individuals. Obesity, or a BMI equal to or above 30, is linked to a 3 times higher kidney cancer mortality rate than normal weight people. Exercise helps by improving your metabolism, immune function, and reducing inflammation, which may in turn slow tumor growth. Overall, it promotes better outcomes both in prevention and post-diagnosis survivorship. And the data on the side shows basically what I just said. Treatment and its effect on the exercise response. Exercise during treatment is safe and beneficial for most cancer patients, including those going through chemotherapy. It helps to reduce fatigue, anxiety, depression, and improves quality of life. It supports heart, lung, and muscle health during treatment. Exercise can enhance chemotherapy effectiveness by improving blood flow and drug delivery to tumors, which is amazing. Activity should be individualized based on the treatment side effects, fatigue, and fitness level. And the general goal going through all of this is about 150 minutes a week of moderate exercise like walking or cycling, and it can be adjusted as needed for anyone. For my case study, I am using my dad, sort of. Some of the information from him was very helpful, and Some of it's made up, some of it's tied together with what he went through. But overall, 55-year-old male, no history of smoking, high blood pressure. He has kidney cancer and currently is taking lisinopril for his high blood pressure to bring it down. Most days he is active and exercising, which is great. He does need clearance from his doctor before going through with an exercise program or starting. His goals are to maintain or slightly improve fitness while undergoing treatment. Now, for exercise tests, for our aerobic tests, I picked a 6-minute walk test during which we will monitor the heart rate and RPE, which is most important to know where we're at, how he feels, and when to stop the test. Stopping the test for chest pain, dizziness, or overexertion. For the strength test, I picked the hand grip test and the 30-second sit to stand test. We will only perform this if the patient tolerates movement well, and we'll stop for dizziness or legs buckling, fatigue. For flexibility test, we'll do full body static stretching and light mobility movements. Fit prescription. We'll be doing for aerobic 3 to 5 days a week, light to moderate, or an RPE of 2 to 4 out of 10. Should be able to speak in sentences. We'll do this for about 10 to 20 minutes, or it can be broken into smaller sections based on fatigue level. For type, we'll be doing low impact activities like walking, stationary cycling, or low speed on the treadmill. For strength, we'll be doing 2 to 3 non-consecutive days a week as to accommodate for fatigue and treatment cycles of light to moderate RPE or 3 to 5 out of 10. We'll be doing 1 to 2 sets of 8 to 12 reps per each major muscle group and low volume. We'll be doing functional and machine-based lifts like leg press, chest press, and sit to stand test, and resistance bands, and avoiding free weights so as not to injure. Flexibility we'll be doing 4 to 7 days a week and can be consecutive or non-consecutive. We'll be doing gentle stretching sensations for an RPE of about 2 to 3 out of 10. Shouldn't feel any discomfort or pain. Each stretch will hold for about 20 to 30 seconds and repeat 2 to 3 times. The type would be static stretching, targeting major muscle groups, using seated or lying positions if feeling dizzy or fatigued. Special considerations or modifications will be energy levels varying daily, so we'll adjust duration and intensity based on how the patient feels each day. Using RPE instead of heart rate because chemotherapy can alter heart rate response. We'll keep aerobic intensity light to moderate to avoid overexertion. Avoid heavy strength loads due to increased risk of fatigue and muscle breakdown because of chemotherapy. If platelets are low, avoid high impact exercises and activities with fall or bleeding risk. If hemoglobin is low, avoid high intensity work due to reduced oxygen capacity. If neurotropenic or having low immune functions, we're going to avoid crowded gyms and focus on home or private clinic settings to not expose to germs and pathogens. If neuropathy is present, avoid balance demanding exercises and free weights and focus on seated or machine-based movements. We will schedule exercise on higher energy days, typically not within the first 24 to 48 hours after a chemo infusion because that will knock you off your feet. We'll use stable positions like seated or supported or machine-based to increase safety and reduce fall risk. And we'll be monitoring symptoms before every session for fatigue level, dizziness, or nausea. And we'll be stopping exercise immediately if chest pain, severe shortness of breath, dizziness, or bone pain occurs that hasn't previously been there before. All right, these are my references. And this is my dad, who I loosely based my project off of and had some pointers and tips from. Great guy, absolute best friend. He had kidney cancer a few years ago when I was in high school and going into college, and he was active through all of it. Like, you wouldn't have known that he even had it. So I just thought that considering that, it would have been a great topic choice for me. So that's it.